Good day, my name is Milan. I'm a registered physiotherapist with Pain Free Health Clinics, and today we're going to discuss the adductor muscles, adductor longus, brevis, magnus, and the gracilis. So we're quickly going to go into the referred pain here. As you can see, the groin muscles, they can refer into as far as down into the knee and all the way down up into the hip flexor. You can see in this direction, obviously they're going to be referring into the groin, but they can also refer inside, give people that pelvic floor pain as well. And then also, this is the back view. You can see the trigger points are right close to the ischial tuberosity as well as down in this location. And this is the trigger points for the gracilis muscle. You can see it goes right into the pes anserine. So basically there's proximal trigger points, they refer upward into the groin. Distal trigger points, they refer down to the knee as well as into the shin. As you can see right in here, adductor longus trigger points are a common cause of direct groin pain, and mid-thigh trigger points, adductor magnus, refer along the anterior medial thigh from the groin to just above the knee. You can see all the way in that fashion. Here's the quick anatomy of the muscles. You can see your pectineus right in here. The adductor brevis is right behind here. You can see it's quite deep. Here's your adductor longus. Behind is the adductor magnus here. This will give you a better view. This is the back view. You can see how big the adductor magnus is. Essentially, you can see that the adductor magnus has all these different types of fibers, which can essentially be called different muscles as well. It's adductor magnus seems to be a collection of different muscle fibers, as you can see here. And then also this is the gracilis, pubis, and you can see this is the medial view. You can see it's coming right into the pes anserine straight down, and this can be a big implication when it comes to knee pain. Function. Adductor muscles play key roles when it comes to, so for example, let's look at the gait phase. Early swing phase, adductor magnus moves the limb towards the midline. Late swing phase, adductors and gracilis help maintain hip flexion for a forward reach. Early stance phase, gracilis assists pes anserine muscles and vastus medialis in stabilizing the knee as the weight shifts. So this is where someone, when they get pain on weight bearing, the gracilis could be the problem. Later stance phase, adductor longus and magnus control the weight shift and prevent excessive abduction, adding stability. So they're preventing too much abduction, they're improving that stability of the area. Well, same thing, if your abductors aren't working well, then the adductors are going to take over. So they're essentially kind of working together. Toe off and heel strike, adductor longus activates at toe off, while adductor magnus activates at heel strike. Supporting movement and walking, jogging, and running and sprinting. So this is why the groin muscles are very important, especially if you have someone that's getting pain when they're doing these activities. Symptoms when it comes to the adductor longus and brevis, patients with adductor trigger points feel groin and medial thigh pain only during vigorous activity or muscular overload, not at rest. Pain worsens with weight bearing and sudden hip twists. Adductor magnus, patients with proximal adductor magnus trigger points may feel deep pelvic pain, sometimes localized to the vagina or the rectum. They often struggle to find comfortable leg position at night and prefer to lie on opposite side with the thigh slightly flexed. When it comes to the gracilis trigger points, cause superficial hot tingling, stinging medial thigh pain, rarely prickling. The pain may persist at rest without relief from position changes, but improves with walking. Growing mechanical overload. Chronic overload of the adductor muscles is linked to pubic stress, symphysitis, pubic stress fracture, adductor insertion avulsion syndrome as well. Articular dysfunction. Trigger points in the hip adductors can mimic hip OA. So this is very important. So whenever someone comes in with their nice little x-ray of, hey, I got hip arthritis, what do I do? And I got pain, you gotta look at the hip abductors, leading to misdiagnosis. Adductor longus trigger points may cause referred pain that's mistaken for OA. However, deactivating these trigger points can relieve pain even in OA patients. OA pain is usually deeper in the groin and refers laterally, while trigger point pain may refer medially. Proper assessment is very, very important. Activation and perpetuation of trigger points. Adductor trigger points, including the gracilis, can be triggered by sudden overload, obviously, such as slipping on ice, playing sports, may also arise from hip arthritis or after hip surgery. Adductor trigger points can be aggravated by running uphill, downhill, long drives, or prolonged sitting with crossed legs. Patients often link symptoms to a specific event, unlike those with the pectineus trigger points. Associated trigger points, adductor longus, brevis trigger points often occur with adductor magnus and sometimes pectineus trigger points. So the pectineus should always be checked as well. As you can see, it's kind of in the similar range here. Adductor longus and magnus trigger points also involve the medial vastus, the vastus medialis fiber. Since these muscles are closely connected, their fascia forms a bridge above the knee, helping balance medial and lateral pull on the patella. So this is where you always got to look at that, how are the abductors versus adductors doing in someone, and having that balance is very, very important. Either guy's doing too much, you're going to start getting issues. Gracilis trigger points are rarely linked to the adductor trigger points, but may be connected to the sartorius trigger points at the lower end. And like I say, whenever you get someone that medial knee pain, always good to look at the gracilis and the sartorius. And vastus medialis, that's why it being connected to the adductors is very, very important, and that's something that you should consider whenever you have anyone with medial knee pain as well. Corrective actions to prevent trigger points of the adductor muscles: avoid keeping them in shortened position for long periods. So when sleeping, place a pillow between the knees to keep the upper thigh horizontal and prevent muscle shortening. When sitting, avoid crossing one leg over the other or using chairs that force hips into a jackknife position. During long drives, take frequent breaks to move around or use cruise control to allow active leg movement. Keep the adductors in a neutral position to help reduce trigger point formation and muscle tightness.